The treatment approach we will use is behavioral therapy in combination with medication. After the client is assessed and accepted into our program, we will develop his or her treatment plan. It is important that the treatment plan is a collaborative experience with the client, so that the finished product reflects their personal wants and needs. For example, a client may be struggling with being withdrawn, disenfranchised from work or school, sleep issues, and severe audio hallucinations. The client may not feel the need to address their sleep at this time because they like having the extra energy, but they find the hallucinations and issues with their social life to be a problem for them. When developing the treatment plan, the wants and needs of the client will be respected, and as the client begins to function better or later on in their treatment, they may change their mind about the sleep. Then adjustments to the treatment plan can be made at that time to make better sleep patterns as a goal for the client. There will be a treatment team which will consist of the social worker, therapist, psychiatrist, program manager, and nurses, and as well as any medical doctors that the client may have. The treatment team will collaborate to tailor the treatment to the individual client. However, the outline of treatment will be similar for each client and will include a combination of behavior therapy and medication. There are 6 main steps to behavioral therapy techniques that we use. Number 1, assessment. Patient's behavioral assets, deficits, and excesses in a social situation. The purpose of the assessment phase is to discover what behaviors the client is struggling with and wants to change. The assessment phase is very important and needs to be done thoroughly. We implement the assessment in a few different ways in order to accurately zero in on the client's needs. Assessment will be done by way of a self-report questionnaire, or SRG. The SRG, or Q, is a screening of 20 questions that are yes or no. If symptoms are present in the last months, then an answer of yes is given and a score of 1. An answer of no is given. If an answer of no is given, then there is a score of 0. The therapist will conduct structured interviews that are prepared in advance, and the interview questions will be the same for each client. The client will engage in self-monitoring. This can be done in a variety of ways, depending on the needs of the clients and the type of behavior that is being addressed. If the client is experiencing extreme paranoia multiple times a day, and they are at a level where they are cognizant of the paranoia, then they can keep a journal of how many times a day the thoughts occur. If the client is having hallucinations, then maybe a trusted family member can record and play back for the client. This cannot be done in one meeting with the therapist. Rather, it is a process of attaining information that essentially is collected throughout the duration of time working with the client. Number 2, planning phase. Specific social behaviors are targeted for modification, and a rationale for learning these behaviors is given to the client. During this phase, the problem behaviors have been targeted and goals are formulated to help the client meet their needs. These behaviors could have to do with increasing social interactions, increasing functioning. Number 2, modeling. The modeling can be conducted in a few different ways as well, and again is tailored to the needs of the client. One easy way to conduct the modeling is through the therapist-client role-play method. This is where the targeted behavior is demonstrated by the therapist so that the client can see and practice the goal behavior with their therapist. Another method of modeling is for the client to identify behaviors of family members, friends, or peers that they feel meet the criteria for their goal behavior. This is good to use in addition to the therapist-client role play. The client will be an observer of this behavior when they are out in their daily lives, and then they can try to emulate what they see. Often the role play with the therapist will help the client to be able to organize or recognize when they see others. Behavior rehearsal. Specific instructions are given to the patient to rehearse the skill. During the behavior rehearsal, the client will practice by rehearsing the dialogue in their head, writing it out, what they will say or do, or, of course, practicing with the therapist. After the therapist models the behavior, the client will practice modeling it back. 5, shaping and positive reinforcement. This is when positive feedback is given to the patient for specific components of the skill performed well, and corrective feedback is given to improve the performance. Then homework is assigned. The homework assignment is given to practice the skill in the natural environment to facilitate generalization of the skill. So this is when the client will actually go out into the world and apply the skill in their real life. Then they will have the opportunity to come back to let the therapist know how it went, and the therapist can continue shaping and using positive reinforcement.